Greetings and welcome to Covered in Love. This is just a simple conversation that we've decided to have today. One where we wanted to simplify the process of Medicare. And luckily, we have joined with us an expert broker who has decided to come and help simplify this process with us. And if you don't mind, young lady, we'd just like to have you introduce yourself.
Certainly. My name is Melissa Story, and I am an insurance broker. And my specialty is Medicare. While I've been a broker since 2013,
Wow.
I've been working with Medicare since 1988.
Oh, wow.
So I have a lot of in depth understanding of Medicare.
So you all heard her say since the 80s.
Yeah.
So we have a giant here and we brought in a giant to let you know that we indeed have you covered as
Yeah.
it relates to Medicare. And I'm not sure if some of you all remember the love letter that I did. I'll link it in the video. But I did a love letter about 2 months ago, and I put in there if anyone had a love letter that they wanted me to do to just reach out. Now, that love letter that I did before, it was about heartbreak. And so I just said, if anybody has a love letter that they want, reach out. It just so happened we got a love letter for Shakira. I need help with Medicare. So here we are, and we've been able to make it happen. And throughout this time, we have some questions that have been submitted, but we really just kind of wanted to have a conversation and demystify, because a lot of people feel like it's confusing, including myself.
Yeah.
And you and I have been talking about this as we've been preparing for this, and even in just talking to you and even getting the questions together, I can see how very confusing this can be.
Yeah. You know, many of my customers are just people at large, can be confused by Medicare because it's like, well, what are the different plans and what are the different parts of Medicare? And then there's so many commercials on TV that says, oh, I can get Medicare and I should be able to get a food card, or I can get a card to help pay my utilities. Oh, I need a supplement, or do I need a Medicare Advantage plan? Or are they the same? So it's a lot of questions, and we can unpack that today.
And we're going to do just that. I think what I would like to do before we even start getting into that, if you could share, not to put you on the spot or
Yeah.
anything, but you've
Put
been
me on
doing
the
this.
spot.
Okay, see, this is why she's the expert, guys. So if you could, over your many years of doing this, share just a story about how you've come in and been able to help someone to, like, what do they look like when they've come into you overwhelmed, and after leaving you, how they feel confident and they feel like, you know what, I now have a handle on this.
Sure. Um, the stories are different, but the storyline seem to be the same,
I love it.
you know? So most often people are overwhelmed because Medicare, although it's health insurance, it's not exactly like the employer group plan that you have on your job.
Okay.
So, because there are so many different parts, and there could be penalties if you're not proactive in selecting the right types of plans,
Mhm.
so people can be overwhelmed by that. So, most often I run into, I'm getting all of this mail, and
Yes.
the mail, they all are saying something that seems to be the same, but so much different
Yes.
because different companies are sending it. I don't understand, why is that the case? How is Humana or Care Plus or Florida Blue, how are they providing me insurance when I also got something from the Social Security office, the red, white, and blue card? What's the difference in all of that? And that seems to be the number one question. And then the number two question is, can I get assistance with paying this premium every month? Because it's $184. And now that I'm retired and I have a fixed income,
Right.
that seems to be a little bit healthy for me to pay.
Okay.
So, yeah. So that's the number 2 question.
Okay.
Is there assistance?
So we're going to start getting into some of that.
Okay.
And in this first section, I think we just start at the beginning, and that is simply if you can kind of walk us through like Medicare 101, like
Okay.
what is it, what isn't it, and why does it actually matter?
All right. So, what is Medicare?
Yes.
So, Medicare is a health insurance plan or coverage that is offered through the federal government.
Okay.
So, the federal government, CMS, which stands for the Centers for Medicare and Medicaid Services, they actually administer the Medicare program.
Okay.
So the Social Security Office, however, is our point of contact through that administration
Okay.
of the health coverage. So can everybody get Medicare? Not necessarily. So there are some requirements that people have to meet in order to be eligible to receive Medicare Part B. So before I get into the requirements, let's talk through what the parts are.
Okay.
So you have Medicare Part A, which is hospitalization coverage.
Okay.
So if you're in a hospital, then you have Medicare Part B, which would be your medical services, your professional services. So when you're seeing a doctor, that's a professional service. To have lab tests done, to see a psychologist or a psychiatrist, to go to the outpatient of the emergency room. Those are what we consider professional services.
Okay.
And then you have Medicare Part D,
Mm-hmm.
which is for prescription drugs.
Okay.
Now, I did skip C, so I said A, B, and D.
Right.
So C is where you have your Medicare coverage, your medical and your hospitalization coverage all in one. Some of those plans also offer prescription drugs.
Okay.
So you can have what we consider an MA, Medicare Advantage,
Okay.
or an MAPD, which is Medicare Advantage with prescription drugs. That makes up C.
Okay.
So, yeah. So, original Medicare, when you get your red, white, and blue card from the Social Security office, it has A and B. So, it has your hospitalization and it may have B for your medical services. Now, let's get into those requirements.
Yes.
In order, everyone can get Part A.
Okay.
There's no cost to Part A. You're a citizen, you can get Part A.
Okay.
In order for you to be eligible to even pay for Part B, you have to have worked 40 quarters or 10 years.
Okay. I was going to say.
You have to have paid into Social Security. Let me put it that way.
Right.
At least 40 quarters or 10 years.
Or at least 10 years. Okay.
So you have some situations, like for instance, I have some people in my family that worked for the city. They started working for the city in the 70s and they worked almost 40 years.
Okay.
But with the city at that time, they were not paying into Social Security. They were paying into their pension.
Okay. Makes sense.
So they were not eligible to receive that rate of the standard rate of, whatever it is every year.
Okay.
To pay for Medicare Part B.
Okay.
However, they could buy it, and it's usually very expensive to buy it.
Okay.
But it was more expensive for them not to have it, so they actually bought it.
Gotcha.
So there is a way, if you don't qualify, if you're not eligible, you can still buy into it.
So based on what you've just explained, it seems like, and you can correct me if I'm wrong, but what I'm understanding is that C is the way to go.
Well, there's not a one size fit all.
Makes
because
sense.
C is what we consider, like I said, a Medicare Advantage.
Okay.
However, some people, based on their needs, they may need to get what we consider a Medicare supplement, or for short, we call it a Med Sup.
Okay.
So original Medicare, when you get that red, white, and blue card, it is, A and B. Original Medicare only pays 80% of your medical services.
Okay.
The Med Sup, which is at another cost, will pay the additional 20% that Medicare doesn't pay. So Medicare Advantage, however, those plans are usually offered through a private companies like Humana, CarePlus, Aetna. Those private companies offer all of the benefits that your original Medicare would typically offer. It's called the Medicare Advantage Plan because they usually have added benefits that are used to differentiate one company from another.
Okay.
For instance, some people may offer dental, some people may offer vision, they may offer silver sneakers, which is a gym membership.
Right.
Some of them may offer, some over-the-counter benefits. So there are advantages that each company get to decide, which ones they want to offer in order to differentiate themselves in the market.
Okay. And that's why a lot of people start getting the mailers.
That's why people start getting the mailers.
We start seeing the marketing because these outside plans, if you will, they're wanting to market to those who will be needed to make these decisions.
Correct. And so there is a list that anybody can buy for everyone who's turning 65. So we have the 65, it's called T65, Turn 65 list.
Okay.
So the T65 list, your name will be on it.
You hear that you guys are on a list.
Now keep in mind, Medicare could be for people who are younger than 65 if they have certain medical conditions.
Okay.
And if they are deemed disabled for at least 24 months, and then they can qualify for Medicare.
Okay. And so these are some of the instances where people can be eligible prior to
turning 65.
Prior to turning 65.
They have to have certain disabling conditions, and the Social Security Administration typically will advise them as to when they're eligible for Medicare.
Okay. With you saying that, if you could explain to us ways to help us recognize the importance of reviewing options rather than assuming that Medicare covers everything.
Oh my God, that is a big one.
Okay.
Because Medicare doesn't cover everything. And when we talk about options, and I previously said that there is no one size fit all.
Right.
You may need to stick with original Medicare and get a Medicare supplement, which is a little bit more pricey.
Okay.
And it also doesn't cover prescription drugs, so you'll have to get a prescription drug plan. So you'll have your Medicare Part B that you'll pay for, you'll have the Medicare supplement that you pay for, and then the prescription drugs. And I'll tell you examples of when people may choose that. And then the alternative would be a Medicare Advantage plan where you have all of that at one price. And most often, there is not an additional premium. So you'll pay your Medicare Part B.
Okay.
Your prescription drugs can be included. All of your hospitalization and medical services all are included in one.
Okay.
Now, there are a few plans that may have an additional premium to have that plan, but there's so many options where you don't have to pay an additional premium.
Okay.
Well, whenever you're looking at a Medicare Advantage plan, so that's when a private company is offering you your Medicare benefits, there are networks that you have to stay within in order to receive the lower cost.
Okay.
And just like when people were working on jobs and had an employer group plan, you can choose between an HMO or a PPO.
Right.
Okay. So the PPOs, of course, and the way I describe that is the HMO is somewhat like when you have a traffic cop.
Okay.
So just consider your primary care doctor as your traffic cop. So if you need a referral, they're going to direct you to different places.
I can see that.
And so a lot of people say, well, I don't want to have to get referrals.
Right.
And we'll talk about that in a moment.
Okay.
But a lot of times you don't know who to go to. So, I wake up in the morning, my back is hurting. Who do I see? Oh, my knee is hurting. Oh, I've had a really bad headache. Who do I see? So you contact your PCP. Your PCP will direct you.
Okay.
And in turn, when they're directing you to these specialists, the specialists now have an obligation to send the notes back to them. So all of your information is now housed in one place with your primary care doctor. So then that way that somebody is looking to making sure that all the medications that you're taking, they work together.
Okay.
because all of that information is in your notes. Now with the PPO, no referrals are needed. I wake up in the morning, I'm not feeling well, I get on the phone, I call the doctor.
Yeah.
I see a specialist, it's within my network, I pay the lower co-pays, fine. But when I go to my PCP didn't know, they don't even know that I went to the doctor, 2 months ago.
Right.
And they also don't know the results of that visit.
Okay.
So it's very important that if you do choose a PPO, that you have all of that information coordinated back to your primary care doctor.
Okay.
Just simply request that the information from the medical records from that visit be sent to your primary care doctor.
And so it sounds like it's not automatic.
It's not automatic.
It's not automatic. I was so excited to have this conversation with you because, like I started out saying, when we started just kind of preparing for this, I know the person that reached out to me was like, I need help.
Yeah.
And, the more I kind of started digging into it, I was like, I need help. And so when I used to think about seniors, I've said this often here lately, that I used to think about my grandparents, but now I think about my parents. And my parents are actually only 22 years older than me. And so now I kind of start seeing myself needing to start kind of thinking about some of these things and trying to figure out some of these decisions. And so given that, I know we tossed around the age 65, but when do you think is like a really good time or age to start kind of thinking about some of these decisions?
Well, as much as we want to think about it, there's so much change in the marketplace.
Okay.
And Medicare is not exempt from those changes.
Sure.
So I always suggest that whenever someone first becomes eligible, typically the Social Security Administration will send the red, white, and blue card.
Okay.
At least 3 months before their 65th birthday.
Okay.
So you have 7 months to initially enroll in a plan. So 3 months before, the month of your birthday, your 65th birthday,
okay,
and then 3 months after.
Okay.
So that would be your initial enrollment period. So whenever I am going out to discuss Medicare with someone who is new to Medicare, I like to talk to them as soon as possible.
Mm-hmm.
And I also like to make sure that I give them 2 appointments.
Okay.
So in the very first appointment, I just simply sit down to discuss Medicare and the basics and talk to them about the difference between Medicare Part A, B, C, and D. Talk to them about their doctors, their preferred doctors, who they want to see, what hospitals they want to see. Talk about networks and to try to get an understanding of whether or not, this person would be good for a Medicare Advantage plan or if a Medicare supplement would be better for them.
Okay.
Because if you have a person who have conditions that require them to see people that work across different networks,
sure,
then perhaps a Medicare Advantage plan would not be good for them.
Okay.
Or if there are certain specialty hospitals that they want to be able to go to, like for instance, Mayo Clinic.
Mm-hmm.
Mayo Clinic does not accept Medicare Advantage plans. So a Medicare supplement would be better for them.
Okay.
So it's truly about that assessment that I'll do. I do a health assessment. I shouldn't say a health assessment. It's more of a health insurance assessment.
Okay.
So that I can understand what would best meet their needs.
Okay.
And then, so we don't make any decisions. It's just a conversation. And then I will summarize my understanding at the end of that meeting and then schedule the second meeting.
Okay.
And when I schedule that second meeting, that's when we're going to have a conversation where I'm going to be looking for you to make a decision about the plan.
Okay.
And I also always advise people to, make sure you bring someone that helps you make those decisions. So if you're uncomfortable or if you're feeling overwhelmed, if you have a loved one that helps you, if you have, a friend, a daughter, a niece, whomever, a grandchild, whoever can help you make that decision, help you process that information, we definitely want them there during the meetings.
Okay. I like that. And based on what I just heard you say, I have a little time. I have a little time before I have to be confronted with this. But for those who are listening, who are encroaching upon that magical age, I hope that you are taking what she is saying, because there's just in the short time that we've been talking, she's already given out so much information. And so this is a conversation that is dedicated. This is your love letter. And so she's already given so much information. And we're going to continue on to the next section, because we talked about what it is, what it isn't, and who's eligible. We've learned so much from there. And you kind of talked about, when I was asking about for me, you told us about the enrollment period. But is there an opportunity to where you could potentially miss enrollment?
Absolutely. Okay, so before I start talking about the enrollment periods that happen annually,
okay,
it is very important that people understand that initial enrollment period when you first become 65.
Okay. So is it then a rolling enrollment for, because people are turning 65 every day?
Every day. So it's rolling. So everyone has 7 months for their particular birthday. So it's always 3 months before your birthday, the month of your birthday, and then 3 months after that 65th birthday.
Okay.
And I'm just saying 65th birthday, I'm just talking in general, because when you become eligible to receive Medicare, then it is the 7 months from the date that you become eligible.
Okay. So is that the difference between the initial enrollment period, general enrollment period, and special enrollment period?
So, and then I'm going to add a few other enrollment periods with that. Okay.
Please do.
So the general enrollment period typically happens, say for instance, if you miss your initial enrollment period.
Okay.
So what I just described was your initial enrollment period. So if you miss your initial enrollment period, then you would have to wait to the general enrollment period, which means that the enrollment period would be between January and March.
Okay.
But your plan won't be effective until July.
Oh, wow.
Yeah. So if you miss your initial enrollment period, then you'll have to wait to the next general enrollment period, January through March, but your plan won't be effective until July.
So just the way my mind is working, if that were to happen to someone, what's the gap, or how does the gap covered for? Like if someone needed some type of healthcare service and their plan wasn't effective until July and it's May, what happens?
That's a great question, because that's a great segue into the special enrollment period.
Okay. This was not planned, by the way. Like I'm just like, wait a minute, what happens in an instance like that?
Now, everybody may not qualify for the special enrollment periods, but there are so many opportunities for special enrollment periods. For instance, if you qualify for a special needs plan, which means that you are chronically ill, you have congestive heart failure, COPD, you have diabetes, those qualify you for a chronically focused plan or a special needs plan. That can get you a special election period.
Okay.
If you qualify for Medicare and Medicaid, that can get you a special election period. And then depending on what's happening in the world, in the state, then that there may also be other special enrollment periods. Like for instance, during the hurricane season, if specific counties were deemed to be affected, sometimes that can give people special election periods. So there are opportunities for special election periods. Everybody may not qualify for a special election period, but most often there are many opportunities.
Okay. Now, can you talk to us about if there were any consequences for late enrollment, or does that exist?
It does exist.
Okay.
And before I get to that, let me give you a few other enrollment periods.
Sure, please do.
So from October the 15th through December the 7th.
Which is the period we're in now.
Which is the period. This is called the annual enrollment period.
Annual enrollment period.
So everyone who has Medicare has an opportunity to select, and this is for Medicare Advantage plans. Okay. Everyone who has Medicare Advantage plans, they're able to select a Medicare Advantage plan for the upcoming year. If they're satisfied with the plan that they have, then they don't have to do anything. It'll just roll over. But if you would like to change, or if you find that the plan that you have, the copays are going up, or some of the benefits that are important to you are then taken away, you may want to choose a different plan. So you have an opportunity to do that between October the 15th and December the 7th.
Okay.
Okay. So let's just say you choose your plan, you choose a different plan. Well, from January 1st through March 31st, we also have the open enrollment period. That allows someone on Medicare Advantage to make one change. So say I choose a plan, and I realize, you know what, this plan is just not working for me.
Yeah.
So rather than me having to suffer with that plan for the entire year, I can make one change between January and March.
Okay, so if we made the plan between a decision between October and December, it's working.
Well, it doesn't actually take effect to January.
Oh, okay.
So you make a plan. I'm sorry, I didn't say that. So you make a change to your plan, or you select a plan.
Okay.
From October the 5th through December the 7th.
Yes.
But that plan does not take effect until January 1st.
Okay.
So here it is in January. I'm always telling my customers, I need for you to make your appointment come January.
Sure.
Make your appointment. I need you to start using it. See your primary care doctor. Schedule for your labs. If you have vision services, go ahead and take advantage of that. And then you find, you know what, this plan, for whatever the reason is, it's just not working for me. Melissa, I need something different. Or a doctor who currently is in that plan, and when we looked them up, he decided that he was going to be in the plan in 2026, but come January the 15th, he's made a different choice.
Oh, wow.
And he said, you know what, I'm no longer going to be accepting plan A.
That doesn't seem like that's right.
Oh, that happens all the time.
That's just me personally. I don't think I like that.
Yeah.
Because you have people who are making these decisions about healthcare in one part of the year, and then you decide, it seems like there should be like a time limit or something on before they can actually make that.
So you got to keep in mind, these are two totally separate types of decisions. The doctor's office, which is a business,
right?
They're able to evaluate their business every month, and they're able to make the changes that they need to make to run their business.
Yes.
Which it has nothing to do with all the customers that they see. They will typically send a letter out saying that we will no longer be accepting this plan. And they will also send a letter out. In that same letter, they'll usually show what plans they will be accepting. Now, healthcare providers are not like healthcare providers from 30 and 40 years ago.
Sure.
And sometimes my customers, my members, they have an attachment to a doctor.
Of course.
But these doctors are people.
They are.
And they have lives.
They do.
And they have, issues. They catch colds. They get the flu. They need hip replacements. They need knee replacements. Their back aches. They have little children.
Yes.
They have kids going off to college that's relocating.
Yes.
So there are a number of reasons why doctors make the choices that they make, because they're people too.
Yes. And I appreciate you for actually humanizing them. I think it is still a little rotten, but I now have a better understanding as to why someone would do that. Because a lot of times we do see doctors in these like kind of ethereal ways that they're the end all be all, and they're not people, so to speak. And so I appreciate you for, like I said, humanizing them. And I could see why someone would make a decision.
Yeah. And the good news is most doctors today work in a practice.
Yes.
So if there are 5 doctors within that practice, and say Dr. E is on my card,
yes,
I can actually see any doctor in that practice.
Okay.
So if one of the doctors leave from that practice, you can still see doctors within that practice.
But it's like you said, the emotional
Yeah.
attachment to them. They're like, I don't want to see that.
Yeah. I see that a lot.
Yeah.
And sometimes it's to the detriment in terms of the benefits that could be offered to my members. So sometimes my members are so hooked on a particular doctor who may not necessarily accept plans that may be more beneficial to the members.
I could definitely
But
see.
members don't want to switch doctors.
Sure.
And so they lose some of the richness of the benefits that may be offered.
That is something to consider, you all. If
Something
you're
definitely to
listening, and
consider.
definitely for those who are approaching this magical age of 65, what recommendation do you have for how to enroll the right way?
So, the right way. That's a tough question.
Okay.
The reason I say that is because there are a number of ways that you can enroll the right way. So you may make a phone call and call a health insurance company, and they can enroll you over the phone.
Okay.
So that's one option. Now, keep in mind, that's one company. So if you decide to call Humana or United Healthcare or Florida Blue or Care Plus or Aetna, you're just calling that one company.
Right.
If you see an agent will typically represent a single company.
Yes.
If you have someone like me who's a broker, I represent all the companies, and what I do is look across companies to find out the best plan that suits you. So, I will take a look at all of your doctors. I will also ask you for any prescription drugs that you would like for me to look up so that I can help you anticipate the cost across the companies, because it's not a one size fit all. All the prices are not the same across companies, and all the benefits, all the added benefits are not the same. In the past, there used to be something that was called just simply OTC, over the counter.
Right.
And plans, depending on the type of plan it is, the benefits could range from, as little as $20 a quarter till, $300 a month.
Wow.
That's a big difference.
Sure.
Depending on the type of plan you have and the type and what you're eligible to receive. So if someone who qualified for Medicare and Medicaid, they typically would get the richer benefits.
Okay.
Okay. Because Medicaid is for those who are financially needy. So they need a little extra help.
Right.
So up until 2025, whenever they got the OTC, then they could use it to buy food, to help pay bills,
Really?
Utility bills, to help pay their rent or mortgage. They could use all of those benefits for that. However, going into 2026, that has changed drastically.
Wow.
You could still use the card for that if you qualify based on the special supplemental benefit for the chronically ill.
Say that one more time.
So it's something that's called SSBCI.
Wow.
Special supplemental benefits for the chronically ill.
Okay.
So not only, and I hate to say it this way, but I'm just going to say it, not only do you have, when you were just poor,
right,
you could get all of these benefits. Now you have to be poor and sick.
Oh, wow.
In order to use the benefits. Like people have been using them, for years. So if you qualify because you have a chronically ill condition,
yes,
and those conditions could range from, like I said, COPD, cardiovascular disease, if you've had a stent placed in your heart, if you have diabetes, if you're obese, it's a number of reasons why you can qualify for those benefits. Once it's verified through your doctor, then you have the flexibility to use the card to help you with, healthy foods and to pay your utility bills and to pay cable bills and whatever else you need to do.
Okay.
If you have that benefit in your plan, but you're not chronically ill, the only thing that you can do is use it for over-the-counter drugs or items, not just drugs, but items.
So when you say that, do you mean like you can go to Walgreens and buy soap, or
Probably not soap.
Oh, okay.
But It depends on the plan that you have.
Okay.
Sometimes it does allow you to go to Walgreens, Walmart, CVS, and you may be able to buy things like toothbrush and toothpaste, definitely.
Okay.
But a lot of your vitamins or supplements that you take, adult diapers, what else? There's a whole, each company gives you a catalog of items that can be purchased using the over-the-counter card.
Okay.
But somebody might actually qualify to get $300 a month for over the counter. But if they don't meet the SSBCI conditions, then they can only use that $300 a month for over the counter items. And it's only so much acetaminophen and ibuprofen you can buy.
I mean, really.
You know what I mean?
Yes.
When they would probably really need it to help pay some of these utility bills.
Yes.
And especially now since the SNAP benefits, have been cut off.
Yeah.
They could go and help buy groceries.
Yes.
And so, I always try to find ways and try to make sure I understand the customer's needs. And this is so, so important, more now than ever.
Absolutely.
Because those dollars make sense.
For sure.
And we have to make sure. So when you start talking about enrolling properly and making sure that we do it the right way, if you don't have someone that's asking you about your SSBCI, then they're not doing it the right way. They should be asking you about that.
And now we know. Now we know that is a very important aspect of this entire conversation. Say it again?
SSBCI.
Okay. That is an important aspect of the conversations that should be being had, and especially during this first wave of open enrollment.
Right.
And so with given your status as a broker, and as you've explained to us, that she has the ability to look across companies,
right,
far and wide, not just with one company. Given that, this is one piece that there are a lot of things that just kind of really upset me, but this right here, the scams that come up, and the ones that unfortunately try to target some of our most vulnerable, with you being able to look across companies and see different plans, what are some red flags, some scams that are out there that people should be watchful for?
Okay. I have to be very careful when I say this because I want to make sure that the viewers understand the difference.
Yes.
When someone is offering a Medicare Advantage plan, it is against the law for us to solicit a Medicare beneficiary.
Can you explain that?
I certainly can.
Okay.
I cannot walk up to a Medicare beneficiary and say, "Hi, do you have Medicare? Well, let me help you. And I want to show you all of these plans, that's a Medicare Advantage plan that's going to give you some added benefits." That's against the law.
Really?
I cannot door knock and ask you about those plans.
I know, with you saying that, I know someone personally who they had people knock on their door.
Okay. Was it for a Medicare Advantage plan or a Medicare supplement?
I have no idea.
See,
I know that
that's the difference.
Okay.
Because if it is a Medicare supplement plan where someone is going to have original Medicare, then the requirements are not as strict.
Okay.
So a lot of times what brokers and agents will do, they may start with, I shouldn't say agents because agents don't do it. So brokers and people who offer Medicare supplements, they may start with saying, "Hey, let me talk to you about this Medicare supplement."
Right. Okay.
And then once we're having a conversation, we'll say, "Oh, I see that this plan may not be the best thing for you.
Okay.
But there are some other plans that may be better for you." Now, in most cases, we have to have what we call a scope of appointment. That's a document that must be signed at least 48 hours before I discuss a Medicare Advantage plan with you.
Okay.
That's also a safeguard for our beneficiaries.
Yes.
So a scope of appointment must be signed before I have that discussion with you about a Medicare Advantage plan. And basically what that says on the scope of appointment it's going to tell you the type of plans that I'm going to be discussing with you. And it's also going to give you permission in writing, you have to sign, that says you give me permission to discuss this plan on this date.
Okay.
Okay.
I love that. And I think that's an excellent safeguard. And when you say Medicare beneficiary, are you talking about the plan participant?
I'm talking about anybody who is eligible to receive Medicare benefits.
Okay.
So they're called Medicare beneficiaries.
They're called
because
Medicare
they can receive Medicare benefits.
Okay. I love that safeguard. And
Yeah.
if anyone over 65 who is currently in a plan and that has not happened, I think you have some questions that you need to be asking of the people who you are doing business with, because I think that it sounds like a fantastic safeguard. It sounds like a fantastic way to protect yourself, your information, even medical information, your medical history. All those things are like highly important and easily manipulated. And people are, the fraudsters are highly sophisticated these days. And so that information, I can't just say enough about how I think that that's such a great thing.
And let me just tell you, of course, when there's a rule, there could be some exceptions to the rule.
Sure.
So, for instance, if I'm in my office and someone walks in off the street and say, "Hey, I would like for you to help me with my Medicare," the first thing I'm going to do is have them sign a scope of appointment, but I'm also going to indicate why the scope of appointment was signed less than 48 hours in advance. So that's an exception.
Okay.
But you should always, always, always sign a scope of appointment whenever you're discussing a Medicare.
And I was getting ready to
plan.
say, even if it's somebody that walked in off the street, it's you still have some type of documentation that protects you as well as them. Absolutely. Yes.
And then in terms of your medical history, I'm just so grateful that I want to say back in 2019, the CMS changed the number that appears on the red, white, and blue card.
Okay.
It used to be the Social Security number with an A or a B. But in this environment where there is so much fraud going on, they recognize how at risk they place Medicare beneficiaries with that Social Security number on it.
Mm-hmm.
So they changed it to what they call an MBI, which is a Medicare Beneficiary Identifier, which is a combination of letters and numbers that make up that identifier for the Medicare beneficiaries. Yeah. So it's an alphanumeric number and it's 11 digits. And it's listed on your red, white, and blue card. Now, when you enroll in a Medicare Advantage plan, most often people like me will say, make sure you put this red, white, and blue card up where you keep your important documents, because you won't need it because you're getting a card from the carrier who now will be offering your Medicare benefits. So if it is Devoted or United Healthcare, Care Plus, you only need to carry that card around. You don't need to carry your red, white, and blue card around.
Okay.
But if you make it, if from year to year, if you decide to make changes to your plans, you may need that card.
So if you can just share with us maybe like one or two misleading, like what are some misleading tactics that might be used like during the open enrollment period?
Where, say for instance, if you're online and you love animals, say you love your dog, and someone says, hey, a lot of times what they'll do is they'll say, well, would you like to get some free dog food?
Okay.
So people will sign up for the free dog food, not reading the small print that says that whenever you sign this, you are giving our company permission to call you regarding your health insurance. So now you get all of these people calling you saying that, hey, you signed something saying that you wanted information about health insurance. You wanted somebody to discuss Medicare with you. That's a big one.
Yes.
So I use dog food, but it could be anything that you see. Make sure that you read the small print. A lot of times when you're signing up for something, nothing is free.
Very true.
And we call those leads.
Very true.
And the company that has that out there, they sell those leads.
Yes.
So they'll sell leads. If I wanted to go out and buy leads, I can just go to a company. They offer the leads to me. And when they offer those leads to me, guess what? It's because you signed up for the dog food.
You signed up for dog food.
And now your phone is ringing off the hook.
Right. Easy way to do that.
That's the number one thing.
That's an easy way to do that.
That's the number one thing. And also, you may have people calling you saying, we can help you with your Medicare.
Yeah.
Now, they're not talking about what type of plan. They're just saying help you with your Medicare. If you don't know who those people are, do not share your Medicare beneficiary identifier with them. Because once they have that MBI and with your effective dates on it, then they can enroll you in plans.
Really? Like, I need you to say that again.
Yes. Once they have that identifier number, that 11-digit Medicare beneficiary identifier that appears on your red, white, and blue Medicare card, I almost said Social Security card, but your red, white, and blue Medicare card, then that's what I need to enroll you in.
Wow.
In a plan.
And so then someone is enrolled in a plan, and then are they then being charged?
Well, most often the Medicare Advantage plans don't have an additional premium.
Okay.
But the way that they'll know it is they'll get something in the mail and they'll say, oh, well, I got this from whatever the company is. And I didn't enroll in that company. I did not enroll in that company.
Yeah.
And so that's how you'll know, because the company will send you a card and start sending you a welcome kit with a new membership package. And so that's how you'll know that somebody enrolled you erroneously or fraudulently.
Wow.
And then you would immediately contact that company and say, I did not enroll in this plan.
The likelihood, though, of someone actually following through, a lot of times people they don't even sometimes maybe check the mail sometimes or even realize it, and they're like, oh, I guess I did sign up for dog food, so maybe this was a part of it. And then they're just being like, in this ecosystem.
Well, that's a little bit different, because you can't sign up for the dog food and then get a plan.
Okay.
Can't sign up. That you would actually have to give your Medicare beneficiary identifier number to somebody.
I see.
So a lot of times when people are asking you for information, if you don't know who the people are, do not give your information over the phone.
Yes. Do not.
Or do not give people your information, even if they were to approach you and come to your house. If you have not consented to have that discussion with them, do not give your information.
Very key. That is very key. And so we're kind of nearing the end. Want to just kind of talk a little bit about, we've talked about different plans and different services, different benefits and things like that. But if you could share with us how someone could make the most of Medicare and how they could potentially maximize on those benefits.
That is such a great question.
Okay.
And I know that I contact my customers a couple of times a year, particularly when I see them. I'm always asking questions like, have you gotten your flu shot? Have you done all of your preventative care? Have you gotten your pneumonia shot? Have you gone to, have you used your benefits for your glasses? What about dental? Have you gone to get your teeth cleaned? Whatever benefits that they have on their plan, when I sit down to talk to them at least once a year, I'm going to be asking about that. Have you been using your OTC? Because sometimes people get the benefits, and say if it's $50 a quarter, and they'll say, oh, I haven't used it. Well, it accumulates, but at the end of the year, it's wiped clean.
Okay.
So we need to make sure that you're using it. Go out and buy the acetaminophen and the ibuprofen and whatever else you might need.
Yeah.
Or your family might need.
Right. Just go use it.
Use
go
it.
Use the benefit.
Yeah, because if you don't use it, you lose it.
Yes.
And one of the key factors of the plan, especially a Medicare Advantage plan, because earlier I said that companies get to decide what additional benefits they want to include to differentiate themselves.
Right.
Well, if you've chosen or selected a plan that have those benefits, it just makes sense to use them.
Yes.
If not, then they're just sitting there unused.
What are
The gym is one of
I
the
was just
main
getting ready to
reasons.
say. I was just getting ready to
One of the
say.
main benefits that
Yeah.
people don't use.
I was just getting ready to say. I know from personal experience dealing with my parents that with the silver sneakers is one
Yeah.
thing that my mother loves. And so what do you see as like outside of like maybe I'm not a gym person. So like what are some benefits that you see other people take if they don't use the gym benefit?
So like the vision,
Okay.
you know, like the dental.
Yes.
Oftentimes there are some plans have transportation.
Really?
So they have so many, like say for instance, the plan may offer 26 one-way trips. And the reason they call them one-way trips instead of round trips, because years ago it used to be round trips.
Okay.
But then that was kind of sliding some people because, say for instance, I'm going to the doctor. I don't have a ride to the doctor, but my daughter is going to meet me there to help me during the appointment, and she's going to take me back home.
Yes.
Well, when I call, now that's just one-way trip that I've used. So now I got 25 more.
Okay.
If the plan offered 26.
Okay.
So some plans have transportation on them. Some plans offer the rewards where they'll give you $150 back if you were to buy like an Apple Watch or some kind of step tracker.
Okay.
If you wanted to participate in classes that cost money, like if you want to do yoga or Tai Chi or something like that, sometimes they'll give you so much money back every year so that you can participate in those type fitness classes.
Okay. I like that.
So
I like that.
It just depends on the plan.
And it seems like there's some customization that can be done.
Well, you typically, what do you mean by that?
Well, it seems like, well, if depending upon the plan, like you said, you can kind of, some companies have different features to differentiate themselves. So if I decide that I may want this or I may need this, like, can you pick and choose, or is there customization?
I wouldn't say customization. You can choose between what is offered.
Okay.
If you call that customization, then yes.
Okay.
But you can choose between what is offered.
Okay.
Yeah.
And so can you explain why an annual plan review would be critical to maintaining proper coverage?
Because your people's needs change.
Yes.
Their needs change every year.
Right.
So while I was on a plan, for instance, I think of my three sisters that I helped with their Medicare.
Okay.
And they always talk amongst each other, and they always leave frustrated after that conversation because they all three have different plans.
Yes.
But what they're not saying to each other is, well, my needs are different because, you know, I have one sister, when she retired, her company gives her $2,000 a year in a health account.
Okay.
So I can put her on a give back plan where the plan gives back the amount of money that she typically pays for her Medicare Part B premium.
Okay.
So for instance, it may give her back $174 every month, but the co-pays are higher. So when she goes to the doctor, or if she has to be in the hospital, she might pay $400 a night for the first 5 nights. Well, I have another sister who doesn't have those kind of benefits, you know, from her retirement plan.
Right.
And she doesn't make as much money.
Okay.
But she makes too much money to get help from Medicaid.
Okay.
But she doesn't make enough money to have those high copays.
Okay.
So I have her on a core plan where if she was to go into the hospital, her payment will only be $125 for the first 5 nights. That's a big difference between $400 and $125.
Correct.
Okay. When she goes to the specialist, she may only pay $10.
Okay.
Whereas the sister that has the give back, she may pay $50 when she goes to a specialist.
Yes.
But she has help $2,000 a year to help her with those kind of costs.
Okay. And the other sister?
And the other sister does not. So I like to every year, because some things may change.
Yes.
The second sister I just described, well, now that she is fully retired and no longer working, now guess what? Her needs have changed, and now she qualifies to get Medicaid assistance.
Okay.
Well, if I had not been doing that assessment, I would not know that her financial needs, her financial contributions,
yes,
to her household changed.
Right.
I wouldn't know that now she qualifies.
Okay.
So every year I'm always asking, hey, tell me about, are you making less money than you did last year? Do you have any new conditions than you did last that you don't mind sharing with me?
Mm-hmm.
Because I never want to pry.
Right.
But if there's something, especially now, if it helps you to meet that SSBCI,
yes,
I need to know about it.
You do.
I need to know about it.
I think you do.
So those are the kinds of discussions that I have with my members. Are you still seeing the same doctors? Oh, you no longer see Dr. Smith? Oh, you see Dr. Jones now. He's your cardiologist. What about your nephrologist? Oh, you no longer have that issue. Let's scratch that off the list.
Mm-hmm.
So does that mean that you no longer take this medication? Sometimes if you were to look at the forms for customers who have been with me for a very long time, I have packets this thick that go from year to year to year to year.
Yeah.
And I keep all of that. And as their situations change, I'm updating that, creating a new needs assessment form for them every year.
It sounds like you take the deep dive.
I definitely do.
It sounds like she takes the deep dive with her clients. And I appreciate that. I mean, you are assisting a subset of people who probably without your assistance would be even more confused as I am. Yeah. I mean, we've been sitting here talking and she's been explaining it, but it still feels very confusing. Yeah. And so I appreciate you for even being that beacon and that light to some of our most vulnerable who are, trying to navigate healthcare at this time and stage in life. And it's wonderful to know that they have someone like you that are doing that.
Well, it is my absolute honor. And I count it as a privilege to be able to help my seniors and my customers. And the thing that I love about being a broker is, and I say this all the time, I do not work for a company. I work for my customers.
Yes.
I have no incentive for them to choose one plan over the other because I get paid the same amount regardless of which plan they'll choose.
Yeah.
I get paid from the company and it's the same amount. It doesn't matter whether you choose Humana, United, Aetna. It doesn't matter. So I have no incentive to push one plan over the other. I don't have any quotas that I have to meet because I'm an independent broker.
Yes.
So I'm going to take as much time as I need with my customers. And I'm also going to offer them the plans that work best for them based on their needs.
And I love that. And I don't know if you all have noticed, but she lights up like a Christmas tree as she's talking about this. So I think you actually enjoy what you're doing.
I absolutely do. I absolutely do.
And so we're going to start wrapping up, but we put out a video asking for questions from social media to see if anyone had any questions that they wanted to submit to our broker here, Melissa. And we actually have a couple. So you don't know what these questions are.
I don't.
And so we're going to see, like I said, she lights up like a Christmas tree and we just want to see if she's going to continue to light up.
Okay.
And so here's the first one. If I'm still working after 65, do I even need to sign up?
Very good question. So working doesn't necessarily mean you have coverage. So let me go back and expand that question.
Okay.
The question that I would ask or want to amend that question to would be, if you're still working and you're receiving employer group coverage, do you have to apply? The answer would be no.
Okay.
But what you would have to do is to let the Social Security Administration know that you want to defer your Medicare Part B So there is an action that you must take in order for the Social Security office to know that you're still receiving your health benefits under your employer group plan. And because Medicare Part B does cost you, you don't want to have that cost, you don't want to incur a cost for a benefit that you're not going to use. So always contact the Social Security Administration as soon as possible to let them know that you are still working and receiving healthcare coverage through your employer group plan and that you want to defer your Part B.
Okay, defer your Part B. Got it.
Yes.
And so the next question we have is short-term insurance necessary?
Short-term insurance is not necessary. And I'm assuming when you say short-term, I'm assuming that they mean short-term medical. Maybe it's something to bridge. I'm not sure of.
Yeah, that was all they said.
So let me just tell you my understanding and experience with short-term insurance. So say, for instance, there is a gap between the time that you leave your employer group coverage and when you're eligible to receive your Medicare Part B or your Medicare coverage. So you could get short-term insurance, or you could just get an insurance plan through the marketplace.
That's a whole new thing. That's a whole nother part.
So you remember back in the day when it first came out, it was the Affordable Care Act. People would call it Obamacare.
Yeah.
So you could actually get a plan that would cover you for that period through the marketplace.
Okay.
Now they could be talking about, I don't know if they're talking about indemnity plans, but those are not usually referred to as short-term plans.
Okay.
So indemnity plans could be like hospitalization indemnity. You can get that through AFLAC or some of the other companies. All states sometimes offer indemnity plans. A number of companies offer them, but they're usually not considered short-term plans.
Okay. So maybe that wasn't the terminology. That was the question that was submitted. And if you are watching who submitted that question, hopefully we answered the question. If we did not, feel free to reach out and we'll make sure that we get the question answered, because bottom line, we do have you covered. We got you covered with this. And so we have two more, and this one is a little long, longer than the other ones. But the question was, do I have to apply for Medicaid or I'm sorry, I always mix it up. I'm sorry. You'll have to edit that out. The other question, do I have to apply for Medicare to simply have the extra benefits such as Care Plus? I don't have any chronic disease. I only take high blood pressure meds and iron pills.
Okay, so I want to answer that question by saying this. I think that the viewer who sent that question it may be a little bit confused about how the Medicare Advantage plans work.
Okay.
Care Plus is a carrier. It's a company like Humana, like Florida Blue, like Aetna, like all the other companies that offer Medicare healthcare plans.
Okay.
Okay. Care Plus may have 10 different plans within a county. Okay. So it sounds like she's asking, does she have to enroll in one of those plans in order to get the extra benefits? The answer to that, if you're eligible for Medicare, Original Medicare does not offer you extra benefits.
Okay.
Original Medicare is only going to offer you A and B. Okay?
Okay.
It does not offer you prescription drugs. It doesn't offer you vision care, dental care. It doesn't offer you any of that. Okay?
Okay.
So Original Medicare, which is what you get when you only have the red, white, and blue card, it only offers you A and B. And remember, that only pays 80% of whatever the medical expenses are.
Okay.
Okay? In order for you to get the 20% paid, you would have to get a med sup, which is an additional cost.
Okay.
And then if you wanted vision, dental, you would have to get those plans. You have to pay premiums to have those plans as well.
Okay.
Now, Medicare Advantage plans typically will offer you added benefits. Those are the plans that where you receive your Medicare benefits through a private company like Care Plus, Humana, United Health, Aetna, so on and so forth.
Okay.
Okay. Now, in order for you to be eligible for those added benefits, you have to be in a plan that offer those benefits. So I went the long way around trying to answer that question, but I think the essence of the question is, do I have to be in one of those plans in order to receive those added benefits? And the short answer is yes.
Okay. So again, hopefully that answers your question. If it does not, feel free to reach out to us and we will make sure that we get it the exact answer to the question, because again, we got you covered.
We got you covered.
We got you covered. And then the last one is, how would I know if my doctors and medication are covered before I chose a plan?
Very, very good.
Okay.
And I think I mentioned this when we were talking earlier. One of the things that I do is to make sure I understand who your doctors are and what medications you would like for me to look up so I can help you anticipate the cost. So that's a part of that annual review.
Okay.
And that's also a part of whenever you're new to Medicare, I'm definitely going to sit down and ask you those questions at the end of our first visit. Remember I said we take 2 visits?
Right.
Because now, before I come back to you in that second visit, I'm going to go out and do the research. I'm going to go out to make sure I understand all the plans that your doctors participate in, because those are your options. And then I also will like to look up the cost of all of the medications that you take across plans, because they could cost different amounts depending on the plan. So the drugs, I should say, the formularies for each medication is listed by tiers.
Okay.
So each medication falls into a tier. That tier could range from tier 1 through tier 6.
Okay.
6 and 1 typically are the free. Sometimes 2 is free depending on the plan. But then you have specialty drugs. It used to be a time when we used to be able to say all generics are going to be tier 1.
Okay.
No longer is that the case. And it used to be a time where all generics were free. No longer is that the case, because you can have some very expensive generic medications.
Okay.
And it's very important that before you decide, you know what tier your drugs fall in and how much you should be expected to pay in terms of a copay.
Okay.
Yeah. To me, that's part of any enrollment. If someone is not doing that, they are not enrolling you the right way.
That's not her thing. So when we were having a conversation preparing for this, you had mentioned to me that you had kind of delayed some of your annual enrollment conversations because you wanted to make sure that you knew all of the changes, because so many new changes were coming down the pipe for 2026. Yeah. So I know you can't get into all of them, but if you can just kind of briefly highlight what you're seeing with the new changes that are coming forth for this upcoming year.
Sure. And before I do that, let me just kind of give a backstory. Typically, whenever we are preparing for the Medicare season,
yes,
the companies will have their plans approved by CMS and ready to share. And we usually understand what those plans are before October.
Okay.
And however, we can't discuss them until October the 1st.
Okay.
But that means that, hey, I have all of September. A lot of times in August, they've been ready. Mm-hmm. So in September, we're going through, we're trying to understand all of that. But because there were so many changes, many of the companies did not have theirs done until the last part of September, going straight into October, where they were approved and we were able to really discuss those plans and felt comfortable with it. Well, because of the amount of change and because of the amount of customers I had, I needed to understand, especially with this SSBCI,
yes,
I needed to understand how my customers would be impacted with that. So I sent all of my customers a voice message that says, I will be scheduling appointments with you. I gave them the week that I'll begin scheduling. And I told them because of the amount of changes, I wanted to ensure I, one, understood all of the changes and how those changes would impact them as an individual.
Yes.
So the biggest thing is that SSBCI.
Okay.
So in order to use the OTC, the over the counter for utilities, food, groceries, cable, whatever, they have to meet the chronically ill conditions.
Okay.
Then I needed to go back and check for plans that people already had, if those companies had those labels out there for them already when they met it.
Okay.
Because if they did not, then that means that I need to get with my members to say, hey, they should have contacted you already, and if they did, they have not received a response from you. And then copays changed a lot.
Okay.
Between plans. For instance, I can think of a couple of plans right off the top of my head. I won't call them out.
Yeah.
But last year I offered a PPO. This year, I'm switching those people from a PPO to an HMO POS, which is a point of service. An HMO POS works like a PPO where you don't need any referrals.
Okay.
The only part that really works like an HMO is the dental part.
Okay.
And that's something that my customers may not be aware of, because some people would say, I don't want to do referrals. But an HMO POS, it works like a PPO. You don't need to have referrals.
I've never even heard of an HMO POS.
Yeah.
So this concept started because one person said, Shakira, I need help. You said if I needed a love letter, I need help. And so we started this. I had a conversation with you, and she's like, sure, I'll do it. Let's do it.
Let's do it.
What this has shown me is that this is a much needed conversation. And if that one person was sitting somewhere silently struggling, then there are other people that were out there struggling, trying to navigate this whole system. And so with that, Melissa, can you just share your contact information to anyone who may be listening, because it sounds like to me, you just need to call Melissa. Just bottom line, she did not ask for this. This is not an advertisement for her, but I think that you can sit here and witness. She bears witness with what she's saying. She's been doing this for years and years and years. She oozes with this information. She has not stumbled. She has not stammered. We have not practiced this. This is coming up out of her. And so I wanted to make sure that when I did have this conversation, that it was with someone that was trustworthy. Now, there is no one that is more trustworthy than I can think of that I would, that my own parents use. And I will tell you, her name literally dropped into my spirit one night. Turns out I met Melissa years ago because she is my mother's broker. And my mother has been with her for years. I haven't seen Melissa in years. But when her name dropped in my spirit, because I started to go online and just look for someone, but God had other plans, God had other ideas, and she was gracious enough to have this conversation. And so I went along a way to get to this. But Melissa, if you could just please share with the people who are watching a way to get in contact with you, because I think that there are some people that really need to have some conversations.
Absolutely. So Melissa Story, my contact number is area code 904-703-8608. And my email address is mdiane@storyfinancialgroup.com. And that is MDIANE@storyfinancialgroup.com. I am licensed in the entire state of Florida, and I can help people as long as they're in the state of Florida.
Okay. You heard it. We're going to link her information down below. We're putting it on the video as well. we hope that something has been said to kind of help move you along in this process and during this open enrollment season. If you don't mind sharing some of the major takeaways down below in the comments that you gathered from this conversation and this love letter, we'd greatly appreciate it. We are going to be watching. We will be responding. And just let us know if this is something that you would like to see more of. I'm sure Melissa would love to come and have another conversation because I think
Absolutely.
she lives, breathes, and eats this information.
I also want to add my website
Yes.
is www.gen, the number 3 legacy.com. So www.gen3legacy.com. And if you were to go to my website, if you look under legacy services, insurance is one of the legacy services that I offer.
So essentially what she's saying is, I do a whole lot of things. Check me out. Google me.
That's right.
That is essentially what she's saying. She's been a little modest about it, but what I think that shows is she's just here to serve, and
Absolutely.
she's not being, she's here. She's a wellspring of information and knowledge, and she has afforded herself to us today, and we're so grateful. We're so thankful.
My pleasure to be here.
Yeah, we are so thankful. As we started this out, we said that love covers all. This show was dedicated to a particular senior. We hope that you know that we do have your back. We do have you covered. And from your speaking up, you've helped so many other seniors. And so we just thank you all for watching. Feel free to like, comment, share, and we'll see you next time.
Bye.